Imagine living on $16 a day. That's the poverty line in the United States. On a global scale, we measure poverty in developing countries as the equivalent of living on $2 per day. And in Malawi, a small country in southeastern Africa, 3 out of 4 people are living 90% below that on just $1.25. That makes Malawi one of the poorest countries in the world. According to the World Health Organization, life expectancy in Malawi is between 58 to 61 years old. That's compared to the US, where we're expected to live between 76 to 82 years old. So what contributes to this 18 to 21 year difference in life expectancy? In Malawi, preventable, treatable illnesses and parasitic infections like malaria are the most common causes of death. Like other African countries, HIV is also a huge problem, with the World Health Organization estimating that around 15% of adults are currently infected with HIV in Malawi. Malawi also suffers one of the world's highest maternal mortality rates, where only 43% of new moms and their babies receive any postnatal care within 2 days of a birth. In Malawi, a pregnant woman faces a 1 in 7 chance of dying during pregnancy, birth, or the postpartum period. Both in urban towns and rural villages, widows caring for orphaned grandchildren are all too common. And their young babies face huge health risks themselves. According to the World Health Organization, 12% of children die before the age of 5. And of these children, 60% die within their first year of life, and another 25% die within their first month. One cause of this extremely devastating health problem is a lack of physicians in Malawi. The healthcare system is extremely sparse, with only 300 physicians in the entire country. That's just 2 doctors for every 100,000 people. Access to services, transportation, economic and educational opportunities are also profoundly unequal across the Malawi population. Larger households are much more likely to be poor, particularly those with many children. And overall across Malawi, the average family has over 5. I want to introduce you to one of those children now. Meet baby Zanie. Zanie almost didn't survive when her 19-year-old first-time mother was rushed to the hospital after her water broke prematurely. Zanie was born at only 5 pounds and was discharged after 2 days of birth, even though little Zanie wasn't able to feed at all. Desperate, her mother bought cow's milk, not a healthy substitute for a baby, and little Zanie developed a fever and spots and dropped to just 3.7 pounds. So Zanie was admitted back to the hospital and was referred to the nonprofit African Mothers Health Initiative and their partners, who supplied the family with formula and taught Zanie's mom feeding techniques. Zanie gained weight and has grown into a healthy, beautiful baby, avoiding the fate that too many other Malawi babies succumb to. The cycle of poverty in Malawi and the high maternal and high child death rates has spurred the formation of the nonprofit African Mothers Health Initiative to fill the gap of support for Malawi mothers after delivery and their vulnerable newborns through home-based care and nutrition. Launched in 2005, African Mothers Health Initiative's Mother Care Program provides in-home support for critically ill postpartum women. The program pairs new moms in Malawi's 2 primary hospitals with a local nurse from the organization Joyful Motherhood. The program provides care for women once they return home, including medicine, food, health education, and planning with community leaders on how to transport babies and new moms to a healthcare facility if needed. African Mothers Health Initiative's Baby Care Program also provides nurse visits, formula, and care to vulnerable newborns for their entire first year of life. Because infant deaths are such a large proportion of child deaths in Malawi, by focusing on improving newborn health, African Mothers Health Initiative can significantly impact survival rates and help ensure babies have the basic opportunity to live. The more we know, the more we can do. It will take many more voices to speak out for the many women who are forced to watch their babies die or are unable to live to hold their newborns. Visit www.africanmothers.org to learn more and support mothers and their babies in Malawi. You can make a difference. You can save a life.